12 early signs of diabetes. Diabetes is often called the silent epidemic for a reason. It's a chronic condition that affects millions of people worldwide, yet many don't even realize they have it until it's too late. The frightening part? It can quietly damage your body for years before any obvious symptoms appear. Imagine walking around feeling fine, only to discover one day that your vision is blurred, your energy is drained, or worse, you're facing complications like heart disease, nerve damage, or kidney failure. This isn't just about numbers. Over 500 million people globally live with diabetes, and that number is climbing every single day. The truth is, many of these cases could have been prevented or managed early if the signs were recognized in time. And here's where it gets personal. Diabetes doesn't just disrupt lives, it steals years of health, mobility, and freedom. But the good news, your body does give you clues if you know where to look. That's why today, we're exploring the 12 early signs of diabetes so you can stay informed, take action, and protect your health before it's too late. Let's uncover what your body might be trying to tell you. One of the earliest and most common signs of diabetes is frequent urination. Let's talk about this in detail because it's not just a minor annoyance. It's one of your body's earliest cries for help. When blood sugar levels spike, your kidneys step in to filter out the excess glucose. But here's the catch. They can only handle so much. When they're overwhelmed, the surplus glucose gets excreted in your urine, and water is pulled along with it. This process not only depletes your body's hydration levels, but also forces you to visit the bathroom far more often than usual. This isn't your average "I drank too much water" situation. It's persistent and often happens both day and night. A shocking fact? Studies reveal that frequent urination is usually among the first symptoms noticed by individuals with prediabetes or undiagnosed type 2 diabetes. Left unchecked, this can progress to more severe complications like chronic dehydration, which puts additional strain on the heart and kidneys. What's even more alarming is how subtle this symptom can seem at first. You might brush it off as just drinking more liquids, but the underlying cause could be a serious imbalance in your blood sugar regulation. Globally, diabetes affects over 10% of adults, and many are unaware they even have it. Ignoring early signs like this only delays diagnosis and treatment, which are crucial for preventing complications. So, if you notice yourself constantly heading to the bathroom, don't ignore it. It's time to check in with your doctor. Now let's talk about another early sign: excessive thirst. This symptom often tags along with frequent urination, forming a cycle that's hard to miss once you're aware of it. When your body loses significant amounts of water through frequent urination, it naturally demands more fluids to compensate. But this thirst isn't like the occasional dryness you feel after skipping water. It's persistent, intense, and almost impossible to satisfy. Here's the science behind it. Elevated blood sugar levels create an osmotic effect, drawing water out of your tissues and into your bloodstream, which is then expelled through urine. This leaves your body in a constant state of dehydration. The more fluids you lose, the more your body signals you to drink, perpetuating this endless loop. The real danger lies in what happens if this thirst is ignored or left untreated. Chronic dehydration doesn't just make you feel tired and sluggish. It places an immense strain on vital organs like your kidneys and heart. Over time, this can lead to complications such as kidney damage or cardiovascular stress, which are already heightened risks for people with diabetes. Statistically, excessive thirst is a symptom that's reported by a majority of individuals who are later diagnosed with diabetes. Yet, many people don't associate it with a serious condition until other symptoms begin to show. So, if you're finding yourself unable to quench your thirst, no matter how much water you drink, it's your body's way of urging you to investigate further. Don't ignore it. Next up is unexplained weight loss. A sign that might seem like a blessing at first, but it's actually a major red flag, especially if you're not actively trying to lose weight. Here's what happens. When your body can't properly use glucose for energy due to insulin resistance or insufficient insulin production, it starts searching for alternative fuel sources. First, it breaks down fat, then muscle, to meet its energy needs. This breakdown happens rapidly and often leads to sudden, noticeable weight loss, even if your appetite remains normal or even increases. It's not a healthy kind of weight loss, it's your body signaling that it's in distress. Without glucose to power your cells, the body essentially turns on itself to survive. Unexplained weight loss is particularly concerning because it's not subtle. Studies have shown that a significant number of people diagnosed with type 1 or advanced type 2 diabetes recall sudden weight loss as a key symptom. Despite this, many don't connect it to diabetes initially, often attributing it to stress or other lifestyle factors. If left unchecked, this process can lead to muscle wasting and weaken the body over time. Combined with other diabetes-related complications, it puts you at a higher risk of infections and slower recovery from illnesses. So, if you're experiencing weight loss without dieting or increased physical activity, it's not just a random event. It's a sign your body isn't processing energy correctly. Don't dismiss it. It's worth investigating. Now, let's talk about fatigue, a symptom that's all too easy to dismiss, but could be one of the earliest indicators of diabetes. We all get tired from time to time, but this isn't the usual end-of-the-day kind of tiredness. It's a deep, persistent exhaustion that doesn't go away, no matter how much rest you get or how well you sleep. Here's why it happens. Glucose is the primary energy source for your cells. But when your body either doesn't produce enough insulin or can't use it effectively, glucose stays trapped in your bloodstream instead of entering your cells where it's needed. Essentially, your body is running on empty. Without this crucial fuel, your muscles and brain can't function optimally, leaving you feeling constantly drained. This energy deficit creates a ripple effect. People with undiagnosed diabetes often describe struggling to focus, feeling irritable, or even battling mild depression, all of which can stem from this chronic fatigue. Studies suggest that fatigue is one of the most commonly reported symptoms in individuals with prediabetes and early-stage diabetes. Yet, it's frequently overlooked or attributed to stress, lack of sleep, or aging. What's more, this constant tiredness can impact your day-to-day life, from your work performance to your relationships. If you're feeling unusually tired without any clear reason, despite eating well, sleeping enough, and managing your stress, it's worth paying attention. Your body might be signaling a deeper issue that needs addressing. Now let's focus on blurred vision, a subtle yet serious symptom that can often be mistaken for a simple need to update your glasses. However, it might be your body's way of flagging an underlying issue with blood sugar levels. Here's what happens. When glucose levels are consistently high, excess sugar can accumulate in the fluid of your eye, causing the lenses to swell. This swelling alters the lens's shape and flexibility, making it difficult to focus clearly. What's tricky about blurred vision is how easily it can come and go, depending on how well your blood sugar is managed. This can lead many people to dismiss it as nothing more than temporary eye strain or aging. But ignoring this symptom could mean missing an early warning sign of diabetes. Studies show that fluctuating blood sugar levels are often the first to impact vision before other symptoms become evident. If left unchecked, consistently high glucose levels can damage the blood vessels in the retina, a condition known as diabetic retinopathy. This can progress to more severe issues, including macular edema, cataracts, or even blindness. Shockingly, diabetes is one of the leading causes of blindness in adults worldwide, a statistic that underscores the importance of recognizing and addressing symptoms early. If you're noticing frequent changes in your vision that don't improve with rest or corrective lenses, it's essential to see a doctor. Managing blood sugar levels not only helps preserve your sight, but also protects your overall health. Next, let's explore slow healing wounds and frequent infections, two warning signs that shouldn't be ignored. When your blood sugar levels remain consistently high, it takes a toll on your body's ability to heal and fight off infections. This happens because elevated glucose impairs circulation, meaning less oxygen and fewer nutrients reach the areas that need to heal. At the same time, high sugar levels weaken your immune system, making it harder for your body to fend off bacteria and viruses. Imagine getting a small scrape or cut that should typically heal in a few days. Instead, it lingers for weeks, looking red and inflamed. That's because high blood sugar interferes with your white blood cells, which are crucial for repairing damaged tissues and fighting infections. Research shows that people with undiagnosed diabetes are at a significantly higher risk of slow healing wounds, particularly on the extremities like feet and legs. This symptom doesn't stop at cuts. Frequent infections, such as urinary tract infections, gum infections, or skin issues like boils, are another hallmark of high blood sugar. These infections thrive in the sugar-rich environment your body inadvertently creates, making them harder to treat and more likely to recur. Here's the alarming part. If left untreated, slow healing wounds can develop into more serious complications like ulcers, or, in extreme cases, require medical interventions such as amputation. Now, let's talk about tingling or numbness in the hands and feet, often described as a pins and needles sensation. This is a classic symptom of peripheral neuropathy, a condition caused by prolonged high blood sugar levels damaging the tiny nerves in your extremities. While it might start as a mild annoyance, this symptom is a warning sign of more severe complications down the road. Here's the science. When glucose levels stay elevated over time, it affects the blood vessels that supply your nerves. Poor blood flow reduces the oxygen and nutrients reaching these nerves, causing them to malfunction. Initially, you might feel tingling or burning sensations. Still, as the condition progresses, you could experience numbness, muscle weakness, or even a complete loss of sensation in your hands and feet. The risk here is twofold. First, numbness increases your likelihood of injuries, as you might not feel cuts, burns, or pressure sores. Second, the combination of nerve damage and poor circulation slows healing, turning minor injuries into serious complications like infections or ulcers. Shockingly, studies estimate that up to 50% of people with diabetes will develop some form of neuropathy during their lifetime, often without realizing the connection. If you notice unusual sensations in your hands or feet, especially if they persist or worsen, it's crucial to act. Early intervention, such as managing blood sugar levels and improving circulation through diet and exercise, can prevent further damage and keep this symptom from becoming permanent. Don't wait. Your nerves are signaling for help. Another sign to watch for is the appearance of dark, velvety patches of skin, often around the neck, underarms, or groin. This condition, known as acanthosis nigricans, is more than a cosmetic issue. It's a visible marker of insulin resistance, a significant precursor to diabetes. Here's what's happening beneath the surface. When your body becomes resistant to insulin, it compensates by producing more of it. High levels of insulin in the blood stimulate skin cells, particularly melanocytes, leading to an overproduction of pigment and thickening of the skin. These patches often feel soft but may appear slightly raised, and their sudden onset can be alarming. This condition is closely linked to elevated blood sugar levels and obesity, two major risk factors for type 2 diabetes. Studies reveal that acanthosis nigricans are frequently observed in individuals with prediabetes, especially among those with a family history of diabetes or metabolic syndrome. Ignoring these dark patches can be risky, as they often precede other symptoms of diabetes. They can also be an indicator of hormonal imbalances, such as those seen in polycystic ovary syndrome, PCOS. another condition linked to insulin resistance. Early lifestyle changes, including improved diet and increased physical activity, can help reverse insulin resistance and prevent diabetes progression. Let's explore another telling symptom: increased hunger, even when you're eating regularly. This isn't just the occasional craving or a skipped meal catching up with you. It's a persistent, intense hunger that doesn't seem to subside no matter how much you eat. This phenomenon, known as polyphagia, is directly tied to how your body processes energy. When your cells are unable to absorb glucose due to insulin resistance or insufficient insulin production, they're effectively starving for energy. Your brain, detecting this lack of fuel, signals your body to eat more in an attempt to provide the energy your cells desperately need. Unfortunately, this doesn't solve the problem because the glucose remains trapped in your bloodstream instead of being utilized by your cells. What's more concerning is how this cycle contributes to the progression of diabetes. The extra food, especially if it's high in carbohydrates, further spikes your blood sugar levels, exacerbating insulin resistance. It's a vicious loop that can quickly spiral out of control. Increased hunger is often overlooked as a symptom because many people associate it with stress, a busy lifestyle, or even an active metabolism. However, studies indicate that polyphagia is a common early indicator of diabetes, particularly when accompanied by other symptoms like frequent urination and unexplained weight loss. Irritability and mood swings might seem like they're not related to diabetes, but actually, they're closely connected. When your blood sugar levels go up and down, it can mess with your brain's ability to regulate emotions. High or low glucose levels can interfere with how your brain functions, making you feel more irritable, anxious, or even down. Your brain relies on a steady stream of glucose to stay sharp and regulate emotions. When your blood sugar is unstable, your brain doesn't get the energy it needs to stay balanced, which can lead to difficulty concentrating, mood swings, or feeling off. Many people with undiagnosed diabetes often report feeling unusually anxious or upset, especially when their blood sugar is out of whack. The connection between blood sugar and mental health is more than just temporary irritability. Over time, poorly controlled blood sugar can increase the risk of more serious mental health issues like depression and anxiety. This happens because constant fluctuations in blood sugar affect brain chemistry, making it harder to manage emotions and stress. Keeping your blood sugar stable isn't just about physical health. It's key to maintaining emotional balance too. Furthermore, itchy skin, especially on areas like the lower legs, might seem like a minor annoyance, but it can actually be a surprising sign of diabetes. This discomfort is often caused by poor circulation and dry skin, both of which are common in the early stages of the condition. High blood sugar can impair circulation, meaning your blood doesn't flow as efficiently to certain areas, like your extremities. This lack of proper circulation can leave your skin feeling dry, irritated, and itchy. Itchy skin can also result from dehydration, another consequence of elevated blood sugar levels. When glucose builds up in your blood, your kidneys work overtime to remove the excess sugar, leading to frequent urination and a loss of fluids. This dehydration can make your skin more prone to dryness and irritation. While it might feel like a small issue, itching, particularly in areas like the legs, feet, or arms, shouldn't be ignored. It could be an early sign that your body is struggling with blood sugar regulation. If left untreated, these early signs can progress into more serious complications. Lastly, recurrent yeast infections are a lesser known but important indicator of diabetes, particularly in women. High blood sugar creates the perfect environment for yeast to thrive. When glucose levels are elevated, excess sugar can be secreted through bodily fluids, such as sweat and urine, which feed the yeast. This makes areas like the mouth, genitals, and skin folds more prone to infections. Women with diabetes are more likely to experience frequent yeast infections due to the higher levels of sugar in the vaginal area, which provides a breeding ground for yeast. Additionally, diabetes can weaken the immune system, making it harder for the body to fight off infections. What makes this particularly concerning is that recurrent yeast infections can be a sign that your blood sugar is out of control. If you find yourself dealing with frequent or stubborn infections that don't seem to go away with typical treatments, it could be a signal to check your blood sugar levels. Left unchecked, high blood sugar can lead to more serious complications, so addressing this early can help prevent further issues down the line. Each of these signs, on their own, might seem like no big deal or just a coincidence. But when they start adding up, they're telling a much bigger story, one where your body is trying to warn you that something's not right. The trick is to pay attention. If you've noticed even one of these symptoms showing up more frequently, don't ignore it. Early detection is your best defense against diabetes and its potential complications. By making small, consistent changes to your diet, exercise, and lifestyle, you can make a huge difference in your health. Taking control now could mean a healthier tomorrow, so don't wait until it's too late. You have the power to protect yourself, and it starts with awareness. Thanks for watching. Remember to take care of your health today for a better future. If you found this information helpful, don't forget to like, share, and subscribe for more tips on keeping your body in its best shape.